Okay, the webinar is being recorded. Okay, so yeah, I think for folks in the chat and for folks that are joining us in today, we encourage you to think about, whose land you reside on. And I think, when we think about land acknowledgement and thinking about whose traditional territory we're on, it's so much more than just lofty rhetoric. We want to make sure that we're grounding our land acknowledgement in the way that we are approaching our relationship to the land and our relationship to Indigenous peoples and the ways in which we can make sure that we're upholding Indigenous people's sovereignty, Indigenous people's self-determination in interpersonal and systemic ways. And so really thinking about what it means for you to do a land acknowledgement wherever it is that you reside and how that can actually translate into real tangible actions. And one of the ways that we do that here at ISAR is to think about Indigenous specific anti-racism education and how that's intimately connected to land and sovereignty. Yeah, so that was that. I'm going to pass it back to Gaistes.
Kisla Arzu, I just love hearing her do that. My name is Guy Eustace. My colonized name is Michael Glendale. My lineage comes from Village Island, Turner Island, and Knights Island. English is my grandmother's second language, and I carry with me a name that is very old, and I'm a proud member of the Kwakwaka'wakw tribes. I just wanted to thank you once again for all joining us for this extraordinarily important and wonderful webinar on gender affirming care as integral to Indigenous cultural safety. We're gathered to learn from the Sanyas curriculum team, guest speakers, advisors, and Transcare BC. We'll discuss the recent updates to their training in health for healthcare professionals. This curriculum enhancement is in partnership with Health Canada to educate participants on gender and sexual health terminology issues in ways that individuals and workplaces can ensure safety and equity for Two-Spirit, Indigiqueer, and Indigenous 2LGBTQI+ people in PHSA programs and services. This includes people who are lesbian, gay, bisexual, transgender, and/or gender fluid, queer, and/or questioning, intersex, asexual, and Two-Spirit. Speaking with Sheila, which is just wonderful. Personally, I was talking about how I can't actually remember a time when I wasn't connected with the our Indigenous queer community. From childhood, my teenage years, all the way through my adulthood. When I was growing up, we didn't have terms for it. It was just normal everyday living. And I'm proud to gather with you today and discuss how to make healthcare safer for my Indigenous queer community. So thank you for coming. And with that, I'd like to introduce our first guest, Gwen Haworth. And Gwen is settler born. She's a great-great-grandchild of working class English and Irish immigrants. Most of her relatives live within Treaty 4 and Treaty 6 territories. She has been with Transcare BC for 8 years and is the senior leader in the provincial education program. Before pausing her film work, Gwen's feature documentary, She's a Boy I Knew, was screened at over 100 film festivals. The documentary focused on her family's journey through gender transition, highlighting the importance of self-representation, family narratives, reciprocity, kindness, and love. Thank you for joining us, Gwen. Can you please share some words about how you relate to this really important work?
Oh, thank you so much. Thank you all for being there, and thanks for asking myself and Transcare BC to be here as well. I really do appreciate it. If you've heard me speak before, I like to just lead with my primary identity marker, which is awkward. So I'm sure I'll stumble through things quite a bit, but hopefully some of it is helpful. I'm calling it from the ancestral, traditional, and occupied lands of the Katzie, the Kwantlen, the Tsawwassen, and Coquitlam people. I'm somebody who identifies as a trans woman, queer. Michael, I really appreciate what you said about having people around you in different ways of being in the world. When I was growing up in the suburbs, I didn't have that. And without that lack of visibility and representation or positive representation, I learned to self-silence because that was very loud to me. And I didn't come out until I was 27 in the year 2000. And I felt pretty numb, and that's what got me to that place. When I went through my transition, I really didn't know anyone who was gender diverse beforehand, and very few folks who identified as being sexually diverse as well. And trying to find information was challenging enough as itself. And the opportunity to actually transition, which I never thought I would do, was amazing, but it was also through working alongside people and getting to work in the shelter and the nonprofit housing area that I got to recognize. I actually had a lot of privilege as someone who was a white settler on this land, who spoke English, who was from middle-class families, able-bodied. There's a lot of things I took for granted that I didn't know about. And it was only when getting to work alongside people, hear their stories that they would give me with that I really started to recognize that there's a lot more that I need to learn and unlearn and to do. And getting to work alongside so many amazing people, I feel like I thought I was going to go off and be a filmmaker in Berlin, but I feel like the work I get to do alongside people has just been so much more powerful. And I feel the gift I've learned is that I can continue learning if I keep trying and being okay with stumbling. I found myself moving into doing workshops alongside people. And then in 2015, Transcare BC began. In 2014, the Minister of Health in BC mandated that PHSA address inequity for gender diverse people across BC. And there was an opportunity to work alongside great people to create a bunch of educational resources that would be accessible anywhere, anytime, rather than just in-person workshops before COVID, when people were just often meeting together. Two things to that. Many of the people that I get to work alongside with, including my program director, Lorraine Greaves, who's from the Métis Nation, BC, recognize that although we were tasked with thinking about gender inequity, it wasn't gender in a silo. And we know that also from a Western lens, we often silo these things out. But when we think of people who've been here long before us in Turtle Island, who've come from different places, how people approach gender and sexuality is so different, and there's so much we can continue to learn, and that Transcare BC has to continue to learn and to meet those needs better. One of the things when we first started that was really important to us was to reach out to Indigenous health, because many of us had taken the SANIA's trainings beforehand and should continue to take it over and over and over again. But we knew that we could learn a lot from Indigenous health. And so we reached out early on to help when we were thinking about our framework towards education, to work with Indigenous health. More recently, these Health Canada, grants that we're working on are really exciting for us to recommit to the work that we're doing and to push us further in that work. I'll say just a little bit, but I know there's many other people to speak, so then I will try to just come back in if helpful later. We knew early on that we want to weave recognition around True Spirit, Indigenous queer, and gender diverse Indigenous people throughout our different pieces, but we also felt it was important to have pieces that spoke specifically to that. So we worked with, again, the True Spirit, Indigenous queer, and Indigenous gender diverse communities to create a course called Indigenous Gender Diversity that was led by a course content developer and writer, Kyle Shaughnessy, but also had many different people from communities within the course, and who were also the reviewers as well, and feel really fortunate for that. But as we move forward with the Health Canada pieces, we felt that we need to really commit to thinking deeper about that. And one of the things that's been great to do as of recently is with Indigenous health to be able to collaborate a bit further. And so some of the interviews that were in that course, I know that might be helpful with Indigenous health, but also we're hoping to, as was pointed out earlier, how gender affirming care, it might be integral to Indigenous cultural safety. Indigenous cultural safety is integral to gender affirming care for us, and we need to make sure that we really assess where we're at, where we're failing, and where we can continue to grow. And with our Health Canada grant, we have some extension funding, and we've committed to a much higher percentage of Indigenous subject matter experts from community care providers and academics that will be part of the next wave, because it's very important to hold ourselves accountable to do better work. So we're hoping to do that. So one request I will have is, if you know of anyone who might be interested in this work or helping us improve in our work, we would love to connect with you and work together more, because we want to be able to meet and connect with people across Turtle Island more to make sure that what we're doing is accountable to more people. The last thing I'll try to say, because I'm going to try to wrap it up so that I can let room for other folks, is our piece, what we're doing is a great number of pieces on sexual and reproductive health for trans, two-spirit, and non-binary folks. And we're hoping, and we've been doing a lot of work with subject matter experts, but part of that is also the courses. And part of it is a new website. And for us, we know that many gender diverse folks and their families are the champions who are, so we want to make sure that our content is ungated, that people can access it and champion it to the care providers. So we're creating a bunch of community-facing resources, but also we're leaning on an approach that BC Emergency Health Services took with a handbook that's for first responders and paramedics. And we're going to be creating a clinical handbook for folks that are providing gender affirming care. So when they take the courses or they take the clinical mentorship calls or the ECHO Transcare BC, they also have a place they can come back to so that any information they've forgotten might be there, and that it be something that is evergreen and continues to grow and expand as people encourage us to improve access to that. With this is 7 courses. The first one is called Gender Affirming Relational Practice. And it really is, again, speak to the fact that Indigenous cultural safety, anti-racism, and a number of key practices and ethical considerations are key to giving really in-depth gender affirming care. So in that course, we really do start off with Indigenous cultural safety. And as we talk about the other key practices that come along, we try not to talk about them again in silo, but again, in terms of how they're interwoven and how it's important for that gender affirming relational practice, along with gender affirming care principles and clinical practice, to be a robust kind of way of approaching much more in-depth and inclusive gender affirming care that's suitable for every individual that comes through the door. There's so much more, but I also know that I can ramble, so I'm going to pause there and make sure that you can move on to the next panelist. But thank you.
Thank you so much, Gwen. I could listen to you ramble all day. Those are amazing talking points. That's so important in this work to make sure that we're creating Indigenous cultural safety for every single member of every single person in all of our communities. Thank you so much for sharing. I would like to introduce our next guest, Dr. Sheila McLean. Dr. Sheila is a third-generation white settler who was born and raised on Treaty 6 territory. Dr. McLean has worked in education for 30 years, teaching high school, adult education, graduate and undergraduate courses in anti-racism at the University of Saskatchewan. She is also an organizer with the Idle No More Network. As a scholar and community organizer, her work has focused on research projects and actions that address inequality, particularly on how white dominance is created and maintained within a white settler society. She is a curriculum developer at Sania's Indigenous Cultural Safety Training Program. And thank you so much for joining us, Sheila. Can you please share with us a little bit more about this upgrade to Sania's?
Absolutely, Michael. Thanks so much. And thanks to everyone who started us off in a good way today. I'm coming from Treaty 6 territory, which is now known as Saskatoon. And I have Scottish, Swedish, and Norwegian ancestry, and my pronouns are she, her. And I'm so honored to be here representing the Sania's curriculum team, which includes my brilliant colleagues, Robbie Smoker-Peters, who you can see on the screen, Corvin Russell, and our editor, Elaine Jones. In 2022, Sania's applied for a grant from Health Canada to enhance the work already being done by the Sania's curriculum team and the Indigenous Youth Wellness team. And while we might have different audiences, Sania's curriculum focuses primarily on healthcare professionals across PHSA, and the Indigenous Youth Wellness team work with Indigenous youth. We had similar goals, and that was to deepen the way our curriculum reflected the interconnections between race and gender and sexuality. Our teams know that gender affirming care, as it's been said, is integral to Indigenous cultural safety. The Sania's curriculum is grounded in decades of theory and research. And the analytical and theoretical framework that we use is anti-racism theory, which contends that race is a social construction and that it's been used as a central organizing category in colonial contexts such as Canada. And we can find so many examples of this in the racial segregation that existed and continues to exist, from the residential schools, which separated Indigenous children from white settler children, the Indian Act, the reserve system. Indigenous people have been segregated from settler society geographically, through policy, institutionally, and through everyday practices. But anti-racist scholars also contend that race never operates alone. In the residential schools, for example, Indigenous children were separated by gender. and gender binaries. The Indian Act is both a racist and a sexist document. And so our team worked to deepen the understandings of these interconnections and integrate how colonial ideas regarding gender and sexuality continue to impact the harmful outcomes for Indigenous women, Two-Spirit people, Indigiqueer, and gender diverse Indigenous people. So our course has several pages that ground participants in the anti-racist analysis of these interconnections. I just want to point out maybe a few places where we did some deeper work. We have an anchor page in the history module, which is module 3, on the fluidity of Indigenous conceptualizations of gender and sexuality before contact. We have another page in module 4, which is our theory module that focuses on teaching about anti-racism, that looks at how the white nuclear family with men as the head of the household has been celebrated in mainstream media and other institutions, and how this shapes gender and sexual norms in our society. The exaltation of the nuclear family is one of the pillars of colonialism and of white superiority, and this has been imposed on all of us. We want participants to better understand how people fit into these norms, and how these norms, people who fit into these norms receive many benefits from settler society, and those who do not fit into these norms are punished and are marginalized. And so for people to be able to see how that works was really one of the goals of shifting this curriculum. We have pages that highlight Indigenous cultural renewal and resurgence, and how Indigenous women, Two-Spirit people, and Indigiqueer people are often leading this work today. And so we've integrated information regarding gender and sexual health throughout the training, and included pages focused on how healthcare professionals can enact gender affirming care, giving really specific examples. What does it mean to center relationships in our work? How can we create safer relationships with Indigenous peoples who work with and come for services in colonial institutions such as healthcare? This was really the center of our final modules, like the questions that we brought to those modules. And we really invited participants to think about the power we hold within our own spheres of influence, those of us working in PHSA, and how we can take up gender affirming care as part of Indigenous cultural safety. And oftentimes we found the first step towards that is a simple one: to be humble and to be honest about what we don't know, and realize that Indigenous people are the best experts of their own lives. So the enhancement of the Sanyas curriculum has been a collaborative effort right from the beginning. Our curriculum team has been so grateful to work with the expertise of Indigenous Youth Wellness and their team, with Gwen at Transcare BC, who has generously supported us in discussing the curriculum, in using some of their video clips and content to enhance our training, with Dr. Alex Wilson and Dr. Jared Swidrovich, who are here today to talk about their work. They have been our advisors. They have vetted the curriculum that we've put together. And we really want to stress that the Sanyas BC healthcare training is foundational. So we encourage people to also take the Transcare BC training to deepen their understanding of gender affirming care. This is really just the first steps and just the beginning. And so if you haven't taken Sanyas foundational training for a few years, we really encourage you to take the updated training. And it is going to be ready in the next few months, probably within the next month. We'll have it downloaded and ready for people to register into. And so we will keep everyone updated about when it's completed so that people can jump in and take the training. And that's really what we wanted to share from our team. That information, again, is a collaborative effort. We were brainstorming, what do we really want people to know about the new training? And so we wanted to give a few specific examples of that.
Well, Gayla Kesla for that. That's amazing. Just to let everybody know, I can see that there's hands up. We're hoping to get questions funneled into the chat for Arzu later on in the webinar. And also, second to that, I will be collecting resources from all you fine folks to post on our ISAR learning page. So every single little bit we can do to connect you to some of those tool sets, I'm going to go for and stick up on our page. Thank you so much. Our next guest is Dr. Alex Wilson. Dr. Alex Wilson is of the Opaskwayak Cree Nation. She is a professor in the College of Education at the University of Saskatchewan. Her scholarship has contributed significantly to building and sharing knowledge about land-based education, Two-Spirit people, Indigenous research methodologies, and anti-oppressive education. Her research and coming in theory have led to classroom and community practices that honor the contributions and lives of Two-Spirit people. As an Adult No More organizer and as coordinator of an Indigenous land-based master's program, she focuses on queering land-based education and the protection of water and land, particularly within the Saskatchewan River Delta. She is co-chair of Two-Spirit People Manitoba and is active in the One House Many Nations campaign. Dr. Wilson has been recognized nationally and internationally for her research and scholarship. Thank you so much for joining us, Dr. Alex Wilson. I'm going to leave it up to you and Gayla Kisla for joining us.
Thank you. Tansi, hi everyone. Wasnas and Tisnigasun, Pamaskatapan, Opaskwayak, Gochinina. So, as the moderator said, I'm from the Opaskwayak Cree Nation, which is in Treaty 5 territory. But right now I'm coming from Ukpiganjik First Nation, which is on Eel River Bar First Nation in New Brunswick. So I'm happy to be here, and I'm really glad that I'm able to be a part of sharing the this enhancement to the training that's already existing. So I think I'd like to focus on two areas. One is on the coming in, as you mentioned in the introduction. What exactly does that mean? Because I know people are using the term, but where did it come from? What does it mean? And then also looking towards a Two-Spirit methodology. So as I mentioned, like I'm from the Opaskwayak Cree Nation, that's where I grew up. And when I was growing up there, it's very similar to what Michael was saying growing up. Like it was just kind of normal. Everything was just kind of normal to be queer. And that was very much how it was in Opaskwayak. And I didn't really see that it wasn't until really starting to go to school. So that's kind of when socialization starts around gender and sexuality and race too. And so it was very early on when I started to see inequities enacted upon me and on my family members and friends, but also how that connected to regulation of bodies and regulation of our own bodily sovereignty. And so as I got older, I was really curious to see, you know, how that changed when people moved to the city, because most of us queer Indigenous folks at some point want to leave the small town and get to the queer meccas. And in our case, it was like Winnipeg or Saskatoon or whatever. And then once getting there, realizing, okay, it's not all that we dreamed it to be. And when I decided I really wanted to focus on something for graduate school work, I was really interested to know how is it that some of us, you know, can be in our communities when we're younger and have very grounded relationships with land and family and community. But then once we get out into the bigger world, it's not often a safe space for us. But how do we keep our identities empowered despite that? And then what does it really mean to be Two-Spirit? And so those are the questions that I really dove into in my doctoral research. And what I did is I interviewed people who self-described or self-proclaimed as Two-Spirit. They were either Métis, Cree, or Anishinaabe. Mostly they were Cree. And talked with a number of them across the prairies and asked them those questions and other questions as well. And what we found through that analysis of all those interviews and those life stories is that there were kind of some themes or commonalities in our trajectory of our lives. And one is that when we were younger, all of us had some kind of a strong relationship or established relationships within our community. And community could be our First Nation, it could be our little neighborhood, or it could be our friend network or whatever. All of us had some strong kinship or other types of relationships with land or people. And after, getting a little older and being socialized primarily through school and other institutions, healthcare, justice system, other institutions, that all of the people at some point had to forget about the interconnectedness of all of our identities, but kind of stress one of those strands. And so people may have stressed their ethnic background or their linguistic background or their gender or their sexuality. And so in many ways, that meant also hiding certain parts of who we were. So some people hid the fact that they were Indigenous, others hid, or tried to pass as white, or tried to pass as straight, or tried to pass as female, or tried to pass as male. And so the end result of that is that people reported to have kind of a fragmentation of their whole self. And then at some point, people kind of had to decide what to cut loose from, or how to cut loose from those factors that were fragmenting the different parts of our identities. And then often, as I mentioned, that meant leaving the community or leaving a family, leaving a birth family, or leaving a school, or, leaving a work situation. So it was like cutting loose from those places where we didn't feel safe. And that was like part of that next thing was finding out where we did feel safe or where we did belong. And part of that was also realizing and being able to articulate where we don't belong. And then from that, people were able to create community. And so this kind of describes the history of the Two-Spirit movement, but also for individuals as well. And so that term coming in most aptly described this theory of the trajectory that individuals and communities went through to come to an identity or identities that were in very much in kinship and relationship in a healthy and sometimes survival, but also healthy and often thriving ways. And so it was like coming into the circle, which often meant like creating your own circle for many people. And then the last thing was like being able now to look back and look in and out and see where the theory, the practices, the policies, and the procedures, some of them written, some of them spoken, some of them unspoken, some of them hidden, were those theories or ideologies that frame and socialize people where they don't work for us. And discipline, and by discipline means like helping them gently or sometimes more forcefully to realize that this is not working, and it's actually not working in a way that is making the world unsafe for Two-Spirit and Indigenous queer people, to the point where many people internalize that and no longer want to be with us in this plane. So this is kind of the process of coming in. And so if you hear that term today, this was kind of the theory of it, where it came from. Of course, that's kind of shifted over the years now as people have been implementing coming in theory into their own practices within their ceremonial spaces, within gatherings, and within classrooms and within community as well. So coming in is LGBT, First Nations peoples' identities, recognizing that those identities are an interconnection of spirituality, sexuality, culture, gender, and also always tied to land, whether that's urban or whatever, including water and sky. So despite the overwhelmingly harmful governmental policies that have existed and been enacted on Two-Spirit people historically, people are still are able to be empowered and resilient and form empowered and resilient identities, not just in response to, in the face of, but also independently. Like, so there's a continuity of energy that kind of has always existed for Indigenous people. That's why we're still here, but in particular for groups that are systemically marginalized over and over again, the same groups. And I would say like Two-Spirit people fall into that category. So individuals and groups alike followed the process of coming into that empowerment. I want to also, oh yeah, and that also part of that was resisting colonial ideologies about sexuality, gender, and the connection to legal rights. So that's kind of always been there. This resistance has been there since day one when Columbus arrived. You know, that resistance to that type of binary thinking and ideologies that were really about enacting violence in order to regulate and then maintain or take resources and land, and also knowledge as well. So there was this kind of ongoing resistance to hierarchical, oppressive colonial laws that, you know, it's still there. That's why we're here today. And then the need for us to address homophobia and transphobia in our own Indigenous communities is also something that's really key. Even the language that we use, like in teachings, for example, such as gender roles. I often hear people talk about gender roles, but really anytime I hear gender roles in my mind, I'm thinking, who's the person that's acting? Because when you hear role, you think of acting, because there's somebody that's always not able to be 100% themselves. And so that's the dangers in kind of using that binary language, or even language that assumes that there are categories or roles for certain bodies that should align with certain body types or certain genders or sexuality. And again, that each nation and each individual has a right to be sovereign, and body sovereignty is a part of that, and also gender self-determination. So when we talk about Indigenous sovereignty, we are always necessarily needing to talk about and think about what does body sovereignty mean within that. And the two aren't mutually exclusive. That they're both important and are part and parcel. So towards a Two-Spirit methodology, and this was some work based on Sarah Hunt and Sandy Lambert's work in BC, but also incorporating some of the thinking and theory that the three of us did. We wrote a chapter in a book, and really it's about what is a Two-Spirit methodology? What does that look like in the workplace? So what it does is it situates our individual bodies and the relationships between bodies, human bodies, but also land, water, animals, our ancestors within a system, within systems of Indigenous knowledges. So it's centering Indigenous knowledges in order to see kind of the possibilities that exist, that have existed in the past, and that can exist in the future. And so there were some guiding principles that we really thought about and tried to articulate based on our own understandings, but also based on research and based on the work of others as well within communities and people that have been thinking and doing and really on a deep level dreaming the possibilities for us. So these guiding principles were like the importance of relationality. So I think in all of our Indigenous languages, we have a term that acknowledges the relationships between everything. So that's relationality, whether you call it kinship or, you know, all my relations, like a short prayer. In our languages, we have an acknowledgement of that. And so with each of those relationships, and not just humans, there's an accountability that comes along with that. So we wanted to recognize that and also have that as part of the guiding principles for understanding a two-spirit methodology. And as I mentioned before, body sovereignty is a huge part of that. And also consent and gender self-determination. So this is kind of an ongoing cycle of accountability that exists. And then just to end, here were some of the practical applications of a two-spirit methodology. And one is inviting self-identification. So for practitioners, you know, to have people say how they identify. That's, you know, it's a basic one, but why is it one of the biggest issues in schools right now? Why is that policy trying to be, you know, implemented? Why is it in Saskatchewan and other provinces? So it's just a simple thing, like invite people to self-identify. It's really not that hard. And, you know, this morning, we were working with second grade students in the forest school here. They totally understand. They understand non-binary. They don't think in binaries. They get it. So there's a lot that can be learned from a 7-year-old, really. So if they can understand it, then I feel like, you know, our politicians ought to as well. And then part of that too is fostering safer or braver spaces. So if a person has the safe and brave space to be able to speak their truth, then, you know, that's the ideal. And part of that, unfortunately, is having to delink ceremony and the gender binary. And again, that's in reference to Indigenous communities, but also, of course, it's in reference to the larger religious institutions that are so connected with our economy and with policy and practices and, you know, across the land. The residential school era, case in point. And so, you know, this is where this thinking came from. And then also that pan-Indian approaches aren't the most successful because each of us, our language groups, all our languages come from the land. So each of our language groups is very specific to the geography in our areas. So applying a geographic lens is really key. And then, you know, if some of you might have seen this hashtag, it's, you know, it's not new, but nothing about us without us. Native Youth Sexual Health Network uses that, and many Indigenous queer people use that as well. And so nothing about us without us. So always have the people that you are trying to learn about, you know, as part of developing the curriculum or developing the policy practices or procedures. So that's kind of it in a quick summary. And I'm really excited to hear more from you. And if anyone has questions, you can contact me at the University of Saskatchewan. I'm really easy to find. So you can ask me now.
Gaila Kisla, thank you so much for sharing. That was just beautiful. You know, decolonize in every situation. I just love that message. And it is about the land and making space for our people to gather again, and decolonizing ceremony. I just feel super uplifted by your words. Thank you so much for sharing. Our next guest is Dr. Jairus Svidrovich, and Dr. Jairus pronouns are he, they, is an assistant professor teaching STREAM and Indigenous engagement lead in the Leslie Dan Faculty of Pharmacy at the University of Toronto. He is also the founder and chair of the Indigenous Pharmacy Professionals of Canada. He is a queer, two-spirit, Saulteaux, and Ukrainian pharmacist from the Yellow Quill First Nation. His primary areas of research and practice include pain, HIV/AIDS, substance use disorders, 2S LGBTQ+ health, and Indigenous health. Svidrovich is the first and only Indigenous faculty member in pharmacy in North America and is recognized with several awards and honors, including the Queen Elizabeth II Platinum Jubilee Medal for service to the community and the National Patient Care Achievement Award from the Canadian Pharmacists Association. Thank you for joining us, Dr. Jairus Svidrovich. Please tell us more. And I believe you have a PPT to share with us. So Gaila Kisla for joining us. Thank you, Jairus.
You got it. Thank you so much for that introduction. And thank you to each person who has spoken thus far, including the hosts and my friends and colleagues, Dr. McLean and Wilson. And Gwen, nice to meet you in this way. Thank you for your words too. My name is Jairus. I always tell people it rhymes with Paris, so easy to remember. And my Ukrainian dad's last name, you just have to slow it down to Swidrovich, and it's easy to say in that regard. One of the things that Dr. Wilson said near the end about just letting people self-identify, oh my goodness, yes, that was resonating with me, and it reminded me to remind others too that I often forget about, is when you do offer that opportunity for people, especially in a digital way. So I'm not talking about on paper, but if someone's filling out a survey or booking themselves in for a healthcare appointment or something, to don't limit to one identity. Sometimes, I go to check off Two-Spirit and then I go to click off male. And when I click off male, Two-Spirit gets unchecked. And I'm like, hey, no, that's not how I identify. I identify as a Two-Spirit male, right? So don't force function someone's identity to be one thing and let them choose all of the things that they want to refer to themselves as. I've shared some social media handles here, and I will share them again the very last slide, as I love to engage with people in those ways too. But as was mentioned, I am a white presenting, and I always specify that because it affords me, like it was mentioned with Gwen, lots of privilege, a ton of privilege being a white presenting First Nation and Ukrainian person. And also my entire lived experience has been in an urban, suburban type of situation. My spirit name is Wapiska Canoe, or White Eagle, and I see that that comes with many responsibilities. With the eagle flying higher than all other creatures and animals, it's often said that the eagle is responsible for, keeping tabs on what's going on in the world below and carrying message to and from Creator, or God, or whomever else you might interpret to be the creator in your own religion or way of being. And I also walk with two clans, both Otter Clan and Bear Clan. And particularly with the Otter Clan, I draw on as a Two-Spirit person, as a person who's both white and First Nation, as a middle child, and as a person who navigates, Indigenous, First Nations, Métis, Inuit ways of being, thinking, and doing, and then also in the Western system. So I look to the Otter and the teachings of the Otter of how to move between two worlds all of the time in all of these contexts, and how they do it so well, and how they also choose when they are in one of those worlds versus the other. And I too carry that ability. I can choose when I'm walking in a white way or wanting to be perceived as white and not First Nation, or vice versa. So like Dr. Wilson mentioned, that everything is rooted in land and place, and that includes the animals and the teachings that they provided to us. So I draw on those teachings too in the context of being Two-Spirit and gender diversity. I also always call on my own ancestral wisdom of my great-grandfather, grandmother, and mother. My grandparents and great-grandparents attended Gordon Residential School in Saskatchewan, the last to close in Canada in '96. And my mother was a 60 scoop survivor and just passed about a year and a half ago. So I like to bring them into my own consciousness when I'm sharing some of these knowledges. I was asked to do two things, and I will do those two things, I hope. The first is to describe the need for and importance of education for health professionals in gender-affirming care and healthcare, and discuss why gender-affirming care is integral to Indigenous cultural safety and anti-racism efforts. I felt that perhaps one of the best ways to share and emphasize the need for education for health professionals regarding gender affirming care and healthcare is to explore where we are right now. And where we are right now comes from both the literature and my own experiences and the experiences of many others that have been shared with me, whether in the literature, in professional settings, or even just personally. So we do know that Two-Spirit people specifically experience health inequities due to homophobia, transphobia, heteronormativity, and racism, which are all, of course, embedded in the Canadian healthcare system due to colonization. We, as Two-Spirit folks, and I would also argue Indigiqueer and other Indigenous folks who exhibit various forms of gender and sexual diversity, are likely to experience mental health disorders such as anxiety, depression, substance use disorders, and are at a higher risk of suicide. But I recognize and want to emphasize that within saying that, although it sounds like, and it's been being presented as like a deficit theory type of representation, is that these are not inherent characteristics of being two-spirit, nor are they inherent characteristics of being an Indigenous person who exhibits gender and sexual diversity. These are outcomes of being such folks in the land and society that we now exist in, right? So simply being born gender and sexually diverse, intersecting with indigeneity is not cause alone for mental illness. Two-spirit health is impacted by the societal and healthcare exclusion of gender and sexually diverse peoples, as well as homophobia and heterosexism among frontline healthcare practitioners. I know that as a pharmacy instructor myself, going through healthcare schooling, and then even as a teacher, I need to do a better job of this myself, but it's always assumed, the norm is always assumed to be white, cis, hetero, right? And then when someone isn't one of those things is the time that we indicate that in a written or in-person case or a structured case, in a, like when an actor is hired to play a patient for a healthcare professional student in training, only when they are not white or not cisgender or not heterosexual is it then mentioned. So otherwise, always assumed to be one of those. Also, even when an Indigenous person, who a two-spirit person, is wanting to access care, we often have to make a choice of, are we going to an Indigenous run program or a program that is for sexually and gender diverse people? The Indigenous run program may be subjected to the binary of, this is for Indigenous men, this is Indigenous men's group, Indigenous women's group, but where's the two-spirit folks in here? And then when I choose a gender and sexually diverse program or organization, sometimes indigeneity itself is totally missing from there. So the biggest foundational pieces of a two-spirit identity of being Indigenous, First Nation, Métis, or Inuit, and having sexual gender diversity within there, only one of those parts of our central identity are often captured in programming. Two-spirit peoples, we exist at that intersection of multiple minority groups, which of course results in various forms of discrimination such as misogyny, racism, transphobia, and all of these increase health inequities. Two-spirit folks cannot be lumped together with Indigenous peoples in general, or with the 2S LGBTQIA+ community in general when looking at health disparities too, because of these unique intersections of race, gender, sexuality, and other characteristics. It's important to note that when we talk about two-spirit folks and their health, we should not talk about this group as being vulnerable, but rather made vulnerable, or changing the direction of wording and conversation. So, we're not inherently born vulnerable. We're not inherently born marginalized. We're not inherently born underserved. Those are all terms that reflect the dominant society and systems and policies and practices. And so that's where the blame type of language should be directed to, and not to the two-spirit folks themselves. Some experiences related to gender in general, and these ones are not necessarily specific to two-spirit and indigenous folks, but often in the healthcare setting, the patient's gender becomes the focus of their appointment. I have too many friends of mine are cisgender lesbian, let's say, with an acne issue, and it just keeps coming around to like, use protection when you're having sex. And they're like, yet again, I'm here for my acne and I am not going to have sex with someone with a penis, right? And so it just keeps going back to their gender. Or, oh, you're having troubles with your anxiety and depression, because you're trans or because you're gender diverse. And it's like, pardon me, no, I think that's the fault of everybody else and not my own. The healthcare provider often will assume heteronormativity or cisgenderness of the person. The healthcare provider often doesn't respect patient confidentiality, perhaps, and someone might be unintentionally or intentionally outed to other members of the healthcare team, other staff within the healthcare setting, and that information was not, fully offered and shared from the person themselves. So no one else should be privy to that information without permission. Sometimes healthcare providers will mock or trivialize the patient's gender, pronouns, and or name. So, if I was to transition and if I exhibited some social forms of transition, like changing my name, let's say for the sake of this example, to Jenna, which is my sister's name, people would say, oh, well, I've always known him as Jairus. So already they've misgendered me in terms of pronoun and used a dead name. And they feel like, oh, we know each other, we go way back. Well, actually, that's not me, right? So don't trivialize gender, pronouns, and or name. I talked about how people's gender is sometimes blamed for their mental or physical health issues. And sometimes healthcare providers refuse to use the patient's correct name and correct pronouns. And you'll see that I don't say preferred name or preferred pronouns in the same way that I don't call Dr. Sheila McLean James Smith, because it's not her preference to be called Sheila. That's actually her name. Some experiences related to sexual orientation. Healthcare provider does not respect patient confidentiality, often will out someone to somebody else. Home negativity regarding the patient's sexual orientation. Refusal of care or providing substandard care. And yes, this does happen. I imagine that folks on this call are a certain subset of the population who feels like there's no way that could possibly happen. Or you're the folks who feel like, yeah, that's why I'm here, right? Because this does happen. But it absolutely does happen. Indifference or avoidance of the patient's loved ones, and this goes way back in time too, particularly what I think of as the AIDS epidemic, and how folks like same-sex partners were not allowed to visit their dying partner in hospital because they weren't married or legally married or recognized as the person's partner or family. As well, healthcare providers often view all patients as heterosexual. So in the example of my cisgender lesbian friends, they don't need to be talked to about, using a external condom that goes on a penis, because that will not be part of their lives. In some of my own research, I looked at the community pharmacy setting, and the reason I want to share some of these findings and some of this information is because pharmacists and pharmacies, we are the most accessible healthcare professionals, like, period. And that's not arguable. You can't simply just call up, walk in and see a health professional like us in any other type of setting. Additionally, we're often ranked the most trusted professional of any kind. Sometimes we lose to the number 2 spot behind nurses, registered nurses. But in one of my studies, we looked at the experiences of Two-Spirit peoples accessing and receiving care in community pharmacies. And the long story made short is that 3 structural systems were found to dictate how people navigated community pharmacies, which are often the first and sometimes even only form of healthcare that people access, because if they go to a pharmacy and it's a poor experience, what that is conceptualized as is, oh geez, healthcare is not good for me, or these folks aren't great to me, so I'm not going to go to healthcare again. And I try to emphasize that to folks in my own pharmacy community, that it's not about pharmacy, it's that we represent healthcare, right? And I think that we get so focused in our own line of thought that we're like, oh no, that's just us, the pharmacist. Someone had a bad experience with their physical therapist, so they should be fine with us, right? No, we're all part of healthcare. So if any one person in the whole healthcare team ruins things for someone, it's kind of ruined for all of their healthcare experiences. So these 3 systems would be white supremacy, heteronormativity, and capitalism. Those 3 systems presented themselves in the forms of racism, homophobia, transphobia, lack of knowledge, and lack of time, and even greed. And I'll share something more about that. Each of those findings, I've shared some direct quotations from participants themselves of what they've said, and that's all that I'm going to share with you in these next few slides, is what the participants said themselves. One person said, accessing care has always been easier without my status card. So not bringing their indigeneity into the picture. That doesn't mean that sexual and gender diversity alone means that healthcare is easy, but the addition of adding a status card into the picture makes it difficult. All we're asking for is to be treated like someone who doesn't look Indigenous, is what someone else said. In terms of homophobia and transphobia, One person said the further a person gets from the expected binary, the more difficult it becomes for them to access care from the community. Another said, I can't count how many times I've experienced a pharmacist dead naming or misgendering a client name of mine. Some pharmacists, and I'd argue other health professionals as well, don't understand Two-Spirit. So you almost feel judged and scared to go in and access services. This idea that Western medicine is the only way and everything else is just weird stuff. So they're not respecting that I have a different outlook on health. So there's that intersection of knowledge systems as well. Someone was said to or told by their pharmacist, this medication is so expensive because that person was having trouble taking it, or side effects were causing them to not take it all, but they were made to feel bad because of how expensive how expensive the medication was, rather than truly getting down into what was going on with the person. And then folks also frequently said you need to approach all of this like a relationship, because it is exactly that, a relationship. At the end of this particular study, folks shared what is shared very frequently is, what can health providers do? So use inclusive language, add pronouns and preferred names. And the reason I'm saying preferred here is because that's unfortunately the current way that medical documentation systems like electronic medical records will have that. And that's because if I go back to my example of me socially transitioning and changing my name to Jenna, if my legal name is still in province of Ontario's system as Jairus, that can't just simply be changed in the system, in the pharmacy dispensing software, for example, because then it won't get billed to my patient file and it won't go through my drug plan and everything. Anyway, it's a long, complicated story. So preferred name might still appear in some places and spaces, but I would just go with the person's name. Queering the physical space of the pharmacy, being an ally, being an advocate, and of course, incorporating Indigenous, Two-Spirit, and queer education into, in this case, pharmacy curricula, but every other health disciplines curricula, as well as Sanyas, which it is. Not only is gender affirming care integral to Indigenous cultural safety and anti-racism efforts, but it is very much a decolonial act as well. You cannot teach about and or practice anti-Indigenous racism and cultural safety without intersectionality, and intersectionality includes gender and sexuality. So each one of those arrows and words that you see on the screen are all intersections of our own identities, plus others that you won't see there. And I do honor the radical Black feminism from which intersectionality came from with Dr. Kimberly Crenshaw's work. Additionally, gender affirming care has been available to the dominant white cisgender population for a very long time. And I want to emphasize that to people. We often get our arms up in the air, or some folks in society start to, I don't know, have lots of opinions about gender affirming care for sexually and gender diverse people, but we've always had this for cis and hetero folks. So peri and postmenopausal women, they take hormones to affirm their gender identity, right? To feel like a woman that they always had felt before when they were still producing those hormones. Cis men with low testosterone, they go on testosterone. The most popular cosmetic surgery in 2022 for cis people was liposuction, and often people received liposuction procedures that affirmed their identity as woman or man, for example, based on how society sees us as women and men. Breast augmentation, breast implants for cis women, and then for cis men, gynecomastia therapy, so having surgery or chest binders to bring down breast tissue as a cis man. So again, gender affirming therapy that's always been around. Erectile dysfunction medication for people with a penis, that is gender affirming. Wigs for people on chemotherapy or with alopecia, also gender affirming. Finally, here's just a few really quick tips and resources to consider and share as you move forward. One that I will not describe in detail, and I think that maybe many of you have seen this before, and there are certainly other variations, but this gender unicorn, you'll see that everything's on a spectrum, really, and I think that splitting our identities into each one of these specific ways finally makes sense to people. You'll also see that sex assigned at birth is not binary. It never has been. Even in the study of biology and plants and animals, binary is just not true. It's not just like a knowledge system. It's actually fake. There's never been a binary. Intersex people have always existed, and intersex people exist in the same frequency among humankind as people with red hair. So intersex people are everywhere. You all know and love intersex people, and they are not a binary when it comes to sex because it's never existed. One piece of advice that I love to share with people too is 2S then the rest when you're sharing the many acronyms available to us. Plus, many will argue that why do we even have to come out of the closet? Because there are no closets in a teepee, right? It's kind of a fun thing and just a play on history too in how coming out of the closet as if we ever would have came up with that concept ourselves because closets didn't exist. So that's very much a colonial construct as well of coming out, hence what Dr. Wilson was just talking about with coming in. A really great resource here comes from the Alberta Health Services. I love it. It's about sexual orientation, gender identity, and gender expression. It's like a toolkit. Of course, like any toolkit, I don't know that it will encapsulate every single human's needs, but it's going to be better than having nothing available to you at all. Wear a pronoun button in anything and everything that you do. And there are very, very many pronouns. I often share with folks that if you say all pronouns work for you, then you better know what I'm talking about when I say Z, right? Because that's also a pronoun. It's not just he, she, and they. There are very, very many pronouns. Probably just don't use any of these ever anymore. If you're sending mail or addressing someone in person, just call them Jairus, or Dr. Swidrovich, Reverend, some of those types of titles that aren't gendered. I'm just kind of constantly perplexed on how to address a woman based on her marriage status and is she divorced or is she just still single or like my goodness, just call her her name and avoid all of these prefixes. Use your inclusive language anytime and always, whether with patients, colleagues, or anybody in presentations. I've totally banned the term "hey guys" from my own language. Sometimes I catch myself, but hey everyone. An example I use often is on airplanes. So how often when you're on an airplane do you hear like ding, ladies and gentlemen, the captain's turned on the seatbelt sign? I argue that everyone else is hearing, oh, I need to put my seatbelt on. But what people like me are hearing is, oh, my identity is not valid. And I hear that 35 times in a 3-hour flight, right? Whereas everyone else is hearing an announcement. So although it might not mean something to everyone, it means a lot to us to hear ladies or gentlemen. Okay, so anything other than that is clearly not valid, right? The term cisgender refers to people who continue to identify as the gender they were assigned at birth, and so use it. Don't only say trans when someone's transgender. If that's the only time you're going to use a prefix with gender, then it's painting trans folks as other. There's people and then there's trans folks. But no, there's cisgender people, there's transgender people in an equal form of importance and identity. In the same way that you wouldn't say, Prime Minister Justin Trudeau, who identifies as a man, is the Prime Minister of Canada. So don't only just say identifies as for people who are trans and gender diverse. They simply are, in the way that I simply am a cis man, right? I don't identify as such. That is just who I am. I wanted to just share those few important pieces, but I will leave it here. But thank you all for being 2S LGBTQ+ inclusive with your anti-racism and cultural safety work.
Just a few, just I feel certified. That was, wow, that was amazing, Jairus, and all the panelists and everybody. What a diverse group of information and entry points into this conversation. I'm trying to come out of my absorption mode, Jairus, just to be totally honest. I'm looking at a piece of paper and I can't make so much sense of it. I'm just really feeling your presentation. Very connected to this material, also very grateful. Thank you, Gaila Kisla, for the ability to put this up and to propagate this and to champion this with you guys in all of our departments for the time to come. Amazingly, we are sitting at 12:37, so we've got a ton of time here for questions. If you've got questions, please aim them at our zoo. We're going to handle incoming questions as it relates to the webinars, the material, and anything that we've talked about today. So have at it. Let them fly. Let's see what you got.
As I wait for questions to come in, please put your questions in the chat. I'm going to direct my first question to Dr. Wilson, but I just want to say, Jairus, it rhymes with Paris. I'm fangirling here a little bit because I heard you speak last year at the Sania's gathering, and I just got to say that I really love your entire presentation was just so informed by a proper understanding of intersectionality. Oftentimes, Crenshaw's work gets so it's misinformed. It's not, the uptake is just not right, frankly, right? Like it's not a intersectionality was never supposed to be used as like an identity marker. I fill it up with different parts of myself. It's talking about power. And it operates through an interconnection between settler colonialism and gender and sexualized violence. Like those are intimately connected and you can't separate the two. So just like very appreciate you. I like a resurgence of intersectionality that's like properly grounded is so necessary. So thank you. So Dr. Wilson, I just really wanted to ask, you know, just thinking about our work, maybe I'm being a bit selfish as an educator, but just thinking about folks that do this work that are like, that are, you know, whether it's trying to provide dignified and responsive quality care free from racism and gender and sexualized based violence and harm, and providing gender affirming care, focusing on those like misconceptions and assumptions. We talk so much about that at Sania's, you know, I'm no longer at Sania's, but, you know, we still, that's something that we definitely are faced with, you know, with trying to, whether that's the way we write policies, the way we go about workplace practices. What are some of those common misconceptions or assumptions for two-spirited people that can create barriers to safer care?
Thanks for that question. Well, I think the first one is the assumption that we have equal access to care in all institutions, but especially in the healthcare system. So that's a big one because we don't. And a lot of the, you know, a lot of the interventions and a lot of the research that Jairus was connecting to community pharmacy, like it's not just pharmacy, it's hospital, it's every little step of the way. So that, you know, that of course is linked to systemic barriers. But then there's also like the individual little gatekeepers that we face 100 times a day. So whether that's the person on the phone or the reception person, you know, those are all equally as frustrating, and sometimes it can just make a person not want to go further, not even access care. For treaty for people that are non-insured health benefits, that status card, like, you know, again, linking to Jairus's research, often means, again, that we have a different type of healthcare that others don't have access to. So those are the big ones. And then not being seen as fully human is a pretty big one too. Like, you know, whether that's pronouns or just an identity that's not welcome into a space. So any kind of healing space, whether that's in our communities, in healing centers and ceremonies, and then in the more formal biomedical model.
Thank you. Jairus, please go for it.
Yeah, I wanted to add one thing to what Dr. Wilson just also added, in that, yes, if and when, and it usually is when, something like that happens to us, you know, all of these gatekeepers or mini gatekeepers along the way, or that one poor experience. When we look at like epidemiologic data now and looking at the reality of life and how the greatest gaps in health outcomes are between Indigenous and non-Indigenous peoples in Canada, some of that comes down to exactly what was said. So to be really clear, what if I, as the pharmacist, was the first time that person X, who's two-spirit, was accessing healthcare, and I was homophobic and not gender affirming? Now person X doesn't approach healthcare until things get so bad right? And then that's the stat that gets captured in our epidemiologic data. This many people who are Indigenous have diabetes at this level of blood sugar, or this many kidney transplants are needed. Well, yeah, because we've had to face all of these microaggressions that have either made us stop accessing care, or we wait till it gets so bad because we don't want to have to do that again. So quite truly, gender affirming care, like many other pieces of care, can change all of those health stats that have nothing to do with gender or sexuality. It just means that now healthcare is a safer thing to access, right? And we're more likely to return and perhaps come sooner before things get so severe. So it would be very difficult to trace, all of these health stats back to one person's homophobia, right? But I know that those instances absolutely cause these mainstream issues.
Thank you. We often use this, the metaphor of the tree from Dr. Charlotte Loppe, and not focusing on the tree branches, but the root causes of how we got there, right? So I appreciate that so much. So next question, I don't know who to gear this to, so I'm going to throw it out there. So what are some specific things that we can do as healthcare professionals to support two-spirited folks in our day-to-day practices? And I'm thinking also trying to be mindful of like the corporate side of PHSA. Oftentimes, yes, client care relationships, absolutely, but also for folks that are maybe, sitting behind a desk all day, how they are also integral to this conversation.
It was a game of who's going to unmute first, right? So I'll go first. Anytime and always, and it doesn't have to just be when gender and sexual diversity is the focus, right? So instead of saying, ladies and gentlemen, the captain's turned on the seatbelt sign, hey, passengers, the captain's turned on the seatbelt sign, right? Now that's not a moment in time where my gender identity is like slapped across the face, right? So same kind of thing. If I'm going to your organization, I'm taking in a presentation from your organization, I'm reading brochures, and I see he/she, or in your policies, it's, when a person complains about something, he or she should go to, well, again, all of those is telling me that I'm not valued, or I'm not equal, or that I'm the one who's different and everyone else is normal. And so all of the times that has nothing to do with gender or sexual identity, like focus on those times to language, whether it's to individual people or in a broad type of sense. And quite honestly, down to those individual situations, as trivial as some of these things might feel, it can be a world of a difference. So like a pride flag in your organization's front window, right? Probably if I see a pride flag there, it means that you're probably not homophobic or transphobic. Maybe you very well still might be, but versus a place that doesn't have a pride flag, I'm choosing the one with the pride flag, right? So those little cues that tells me and other people like me that I'm more likely to have a safer, better experience here would also be encouraged. Beaded lanyard that happens to be rainbow, and there's two birds with one stone, right? You appreciate and you purchase Indigenous art, and probably you're not scared of the rainbow, right? And like queerness, transness, for example, it's a piece of jewelry, but what many of us see is something so much more.
If I can add one
Yeah.
more
Oh,
piece.
go ahead.
Please. Thank you, Alex. Just want to say, really thinking about the importance of visibility in terms of the people that you work with, in terms of informing your policy, informing your movement forward, and also really thinking about retention and what the systems that people have to work in. So I know that in our team, and not just for gender diverse people, but there's people that have a name used or a first name used that's different than what might be legally on their ID at this point in time, or a specific piece of ID. And if people have to continually out themselves to the IMITS, the ITech, the tech department, or the accounts payable department, or of this, if they're working in cubicles and they're having to out themselves to someone they don't know in a different department, but also in their area. So be thinking about ways we can circumvent creating people feeling unsafe at work, and that may impact retention. And I feel that when we think of folks that are experiencing the intersecting barriers and stigmas based on us not having thought about process, we really do negatively impact that retention and all the gifts people give us, and in terms of thinking about not just folks that are accessing the service, but people who are in the service who then make it safer to access the service. So really thinking about that. So I always think it's really good to think about if you're part of hiring processes or talent acquisition or something like that, maybe think about the process or go through a mock version of, okay, if someone was non-binary, and where in this whole process are those times those binary things come up, or those things in our rooted in our different electronic systems that actually are going to make it harder for folks. So yeah.
Dr. Wilson, did you want to add? Are you?
Yeah, I was also thinking about how the importance of anti-oppressive education for everybody, and because that kind of, the approach that's kind of sticking to the top of the iceberg can be kind of superficial. So like the multiculturalism approach where it's let's all just get along. And so one of the ways us in the community is we call it pink washing. So during Pride Month, there's corporate sponsorship. And so I think that's one of the things that people in the queer community are really cognizant of and critical of. And that is, how does a corporation actually, on a deep level, change policies systemically and practices? Or are they just kind of making it sound like they're, queer friendly when really it's just their stickers? So, and that can create an unsafe space too for people, like the illusion that a place is a safer space when in reality it's not. It's just kind of promoting the neoliberal agenda that ends up marginalizing the same people over and over again.
Dr. Wilson, you're speaking my language. That what you said about the multicultural myth, I love that. That's my forte of disrupting that narrative. So yeah, and how things can get performative, right? And so yeah, I appreciate that so much. Someone just put in the chat here, many PHSA trainings, new hiring trainings, they use binary pronouns. So I guess on that note, what are the ways in which PHSA is driving, gender affirming care forward? What are the initiatives or inroads that are being made on this, given that maybe there's still work to be done?
Well, I think I can probably speak to that a little bit. And, we're at the beginning stages of this work. And I just want to echo Dr. Alex Wilson about the importance of education in this process. And I think, one thing that I've learned in both learning myself and teaching anti-racist, anti-oppressive education is we never realize how deep it goes. Like how particularly white settlers are socialized into particular ways of thinking and being, and that we need ongoing education. So people who have done like a training or people who have done a workshop often think they've got it figured out, but it's so much more than that. It goes so deep, and that we have to think about this as a journey. And we have so much support from our directors and managers at Indigenous Health, who have always encouraged us to have an interconnected view. And so we've been slowly adding material. And this is, one of the bigger shifts that we've made, but we have been adding material for years in curriculum and talking about this for years. But I think it's an ongoing journey. And I know that as a curriculum team, our science team plan on continuing to enhance more and more of our curriculum so that it won't just be in healthcare, it will be in foster care, in justice, in child welfare, in all of our curriculums, in our foundational curriculum. And so that's work that we'll continue to do. And I know for myself, even though I've learned a lot about this, I continued to learn, and it deepened my understanding through this process. and, you know, the people that we've worked with that have so much knowledge on this. So I really encourage people to see this as an ongoing journey, and to not only educate themselves within PHSA, that is one step, but also think about what is your role in the community? Like, what is your role in your family relationships? That you should be, if you are supportive of, you know, Indigenous cultural safety and gender affirming care within PHSA, you should be sharing that everywhere. I think this work is really timely because we know that there has been a backlash and that there are public attacks right now. Our school boards and our government here where I live in Treaty 6 have instituted a pronoun law. And this is about upholding, you know, white settler norms of that, you know, family, of the nuclear family, as really a pillar of colonialism. And what it does is it erases the fluidity of gender and sexuality that are part of Indigenous culture and governance systems. And that's purposeful. It's absolutely purposeful to keep those hierarchies in place. And so I think, you know, this is continued work for us as PHSA employees.
I'm just going to jump in really quick and let you guys know that Alex is okay. She sent me a message. She's just being a dutiful teacher, and she's getting out there to shed her awesomeness to her class right now. So they're going to go do some land-based work, just so if anybody was wondering. Sorry about that, Arzu.
No, all good. There's a comment has come in and another question has come in just a second ago. So I haven't had chance to read the whole comment in full, but I guess in relation to what you just said, Sheila, like, what do we do, you know, and this is for the larger group, but how do, you know, given the backlash that's happening right now in our various communities against queer folks, against folks that don't adhere to the binary, you know, what can we do, like, to advocate to do better, you know, despite, you know, and also like shifting, also seeing this conversation beyond the hours of 9 to 5, right? And that's, but, you know, given that there might not be specific PHSA rule or standards, what can we do more? And I'm thinking here about the importance of like representation and, you know, celebrating and loving queer joy and having that there for folks to see, like, that actually, I think about Alok Menon, like my hero in a lot of ways, talking about how like actually it's like straight people that are really suppressed, like I'm living my best life, like it's you that's kind of sad and like having to adhere to the binary. And so thinking about that and thinking about representation and thinking about how that can also be disruptive, but at the same time that it can't be just enough because it can also get co-opted by capitalism and white supremacy. So that's a big question for 6 minutes, but here we go. Do your best.
So I kind of want to open that up for Jairus or Gwen.
My attempt to respond to this is not even necessarily direct, but I'm just feeling like compelled to share a few things that I'm thinking of when I've been reading some of these questions and comments, and that like other things you can do in this healthcare setting, and even as individuals at your like lunch tables too. I'll share an example of how hurt I was when my parents were talking about how much my dad wanted another boy after I was born. Right. So I have an older sister 4 years older than me, and then my younger sister's 8 years younger than me. And they talked about how, oh, initially, you know, dad really wanted another boy. And so I said, well, why? Like, what do you actually mean by that? Like, you wanted this baby to have a penis and like you just like that genitalia, right? Or is it that you were assuming this child is going to like football, soccer, you know, and that you'll be able to throw catch in the backyard because you can do that with any gender, right? And so then it made me feel, well, am I some massive disappointment then, right? Because my sisters played basketball professionally and I was in musicals and becoming a drag queen. That's another story for another day. But So is it that much of a disappointment, you right, that you wanted another boy? But what does that mean? So like when healthcare providers and other people within these health systems are having this type of communication, like what do you mean? I loved when I heard Gwen talk about pregnant people. Yes, something as simple as that is actually not simple for so many folks. Like, do you mean a pregnant person or do you mean a pregnant cis woman? Are you referring to a uterus or are you referring to the concept of pregnancy? Like be specific in what you mean, and that language, the way of communicating those things has not been shared with us in the ways that Sheila was commenting too, because we've been socialized otherwise, right? This whole like colonial regime comes from a particular knowledge system in which there is no fluidity there. It's not that one's right or wrong, or that one person's adhering to one thing versus another. Multiple truths exist, but we need to recognize that we've been raised and groomed or socialized in this society to have this binary way of thinking, or to say like, congratulations, you're having a boy. What does that mean? And why are people cheering, right? All of that, because it percolates down through so many different conversations between the ultrasound technician and the patient, between someone who's booking, I see that we're booking you for your cesarean section for your boy, or like whatever, like what do you mean? For your child is probably what you mean. So not a direct answer to what was asked, but felt compelled to share.
It
Yeah,
was
I
a
just
brilliant answer nonetheless. That was just, Jairus, thank you so much, because like all the way from utero, harms can be done. So like, please do change your sordid ways and speak correctly to people. I spent the last hour and a half not clicking my reactions button 80%. I reduced the number. I feel like I've nodded my head off for an hour and a half. I've smiled. I've really connected with all of you panelists, and just thinking about the multitudes of our people that are coming into spaces and how to create Indigenous cultural safety for everyone. Thank you so much. I feel enriched. My cup is full. I'm obsessed with my work. I can't believe it. When I see Arzu lean in like that, I know I'm not the only one. So Gaelic Islam to our team and panelists. Sadly, we've reached the end of our gathering, but I would like you to keep an eye out. If you'd like to revisit, I'm going to do a light edit in the forward and back and just post this on our ISAR webpage for our learning pod. So once again, I would just like to thank you all of our panelists for joining us and explaining to us the intricacies and importance of gender affirming care as it relates to Indigenous cultural safety for all of us here at PHSA. So please be safe, everyone. Work on language and have a really great rest of your day. Until next time, Gaelic Kisla from our ISAR team here at Indigenous Health.